As we discussed in the video about going over clinical findings and treatment alternatives, before you move on to the financial agreement, you need to find out as much as you can about the patient's state of mind. Try to figure out early on how motivated the patient is about moving forward with the treatment. Ideally, at this point, the patient has a clear understanding of what's going on clinically. In other words, the patient has accepted that his condition needs to be addressed pretty soon. If during your conversation with the patient you find that he does not have a clear grip on the condition or the treatment, you must stop and clarify the misunderstanding, or refer them back to the clinician or anyone who's qualified to answer clinical questions to go over the information once again before talking about money. The best approach when it comes to talking about the treatment costs is to be upfront with the patient. Let them know that you're there to help them figure out a way to get their treatment done in the shortest time possible in order to avoid any future complications and any additional expenses. Since money can be a sensitive subject for most people, you want to make sure that the patient is willing to have a conversation about the treatment costs and the payment options. But the most important thing, in my opinion, is to genuinely care about the patients and wanting to do everything you can to help them accomplish their treatment goals. You can start by asking, how do you feel about the treatment that the doctor discussed with you? Or do you have any questions about the treatment? If they reply with positive statements like, it makes sense, I'm glad to know, I'm ready to move forward, then it makes sense to continue with the next phase, which is when you summarize the treatment that they are agreeing to. If, on the other hand, they have negative feelings like they seem overwhelmed, confused, or skeptical, then you need to handle the concern before moving forward. And once all the questions have been addressed, then you summarize. You start by summarizing the treatment to be delivered and the conditions that this treatment will address. Make sure you state the dental benefits and highlight the general lifestyle benefits of the treatment so patients can see the value in moving forward. Lifestyle benefits can be, it'll be great to be able to chew on both sides again, or not having to cover your mouth for pictures anymore. You also want to avoid itemizing. So don't go tooth by tooth, procedure by procedure, because that is too overwhelming. Just break it down in phases to make it easier to understand. First phase is gum treatment, second phase is fillings, third phase root canals and crowns, fourth phase replacing missing teeth with dental implants. Once the treatment breakdown has been discussed, ask them once again if what was explained is clear to them. Then you can go back and clarify any doubts about specific services. Just make sure they're clear on the whole process. At this point then, state the full fee. The cost of your treatment is $2,275 or $4,200. If there's insurance, then discuss the insurance portion and the in-network discount and specifically tell them what their out-of-pocket cost is going to be. Pay close attention to the patient's reaction. If you did a good job describing the problems and explaining the treatment process, then the patient will anticipate having to pay according to the treatment needed. If, on the other hand, the patient looks surprised or shocked, then we need to go back to the drawing board and figure out if we missed something or we have to explain something in a different way or maybe consider other treatment alternatives. But if the patient understands, he or she will display in some way their intention of wanting to move forward. We can then go over the payment options. Discussing financial agreements or financial arrangements can be a challenging process because sometimes patients will have different objections to do the treatment that they need. To help you overcome these objections, there's another piece of training material called Overcoming Objections. It is available in a written format, and I encourage you to review it so you can help more patients get their smile in shape. Next video, we'll go over the payment options available in our office.